Ironically, I'm here in Rochester, just down the road from Buffalo, and you're in Texas, where you've had we both had mass shootings that were really tragic to our communities. And there's a lot of discussion around guns and mental health right now. How common is it to see that kind of violence with mental health? And what are the tools that are at a disposal to try to address that? And is that even enough?
This is a huge issue. It's a complex issue. The data does not show that every person who commits one of these atrocities, like we've talked about two recently, but there have been unfortunately many others, and this is a feature of our society more so than others, right, of linking everyone to being a madman or psychopath, or basically talking about a mental health issue. Some have had mental health issues at the time, but there's not a clear-cut relationship, such as we talk about depression and suicidal thinking and suicidal acts. So I think it's very important. While it's such a polarized debate, it's so hard to even begin the conversation about gun violence. Right. But I think we know in our country, there's an awful lot of guns and there's an awful lot of violence. Yes. And just in terms of sheer number of guns, and I come from a place where I would deal with many patients and families that use these responsibly. It's part of the culture. They hunt, their kids hunt with them. It's a wonderful family shared tradition. And it's part of lifestyle. And there's also a lot and other families where violence and video games and movies and all it permeates our culture. I think when it goes together is when, for some people, it could be a toxic mix, especially obviously an untreated mental health problem. So again, improving our mental health system is important, but I'm not sure it solves the whole issue of gun violence in our society, Lou. And that's just my single opinion, not trying to be controversial in that.
No, I agree with you. It's Western New York is different than downstate. Again, lots of responsible people with guns, and you're right. Many times these things happen, and absolutely, it's kind of the act of a madman, but we don't really have a mental health evaluation of the individual to say what's going through their mind. But you're right. It's a much more complicated issue, and the big concern in people's minds, that degree of violence that can come from something like that. But as you pointed out, the suicide rate is much, much higher than that. That's a bigger concern.